Good afternoon, everyone. It's a real pleasure to be here on this frosty day. I'm Saumya Barber. I head up proposition development at Unum. A quick minute about me. I'm an occupational therapist and workplace health specialist by trade, but I've spent the last 20 years or so across sort of consulting and insurance sectors, both in the UK and more globally. That's spanned across many industries from mining, agriculture, transport, to banking, retail, etc. But the crux of it being around understanding the evolving workplace challenges and health challenges and how to tackle it, really. So what we were going to cover today is consider how we can really enhance a digital approach in the health space to make sure it's really working hard for us, both now and in the future, and what part does a connected health strategy play in that. And then finally, we'll just sort of have a quick couple of minutes about what those tools and components are and how can they help us effectively manage absence. So I'll plan to speak for 15 minutes or so, and then, as Janet said, we'd love to hear from you and any questions you might have. Today's workforce is, as I'm sure many of you know in this room and experiencing it on a daily basis, is under immense pressure on multiple fronts, from mental health struggles to difficulty accessing care with the NHS stretch, which now sees about 7.5 million people across the UK on waiting lists, and the ongoing cost of living crisis. It creates unique challenges for employers who are facing rising absence levels and declining productivity in a very much an emerging, tougher climate. The UK has been dubbed the sick person of Europe, sadly, partly due to our productivity issues. And by the end of 2023, around 900,000 UK workers were off due to sickness, which was a significant increase from pre-pandemic levels. So the numbers are getting worse, not better, sadly. And as professionals in this space, it's our responsibility to drive this in the right direction. Despite these tough times, there is absolutely opportunity for improvement. We know that healthy, happier employees are more productive and take fewer sick days. And I'm sure it's no surprise to any of you that obviously good physical and mental health significantly boosts our job satisfaction and financial well-being. We know it works. We've done extensive research on this, and there's substantial research, which I'm sure a number of you have seen. At the back end of last year, we teamed up with the WPI economics team, who are an independent think tank. And they asked over 4,000 employees about their experiences at work. And we found that people with comprehensive benefit packages generally said that they would be 35% more happy at work, 34% less likely to be looking for other job opportunities, and 33% less likely to report poor mental or physical health. So again, we shouldn't be surprised by this, but it does make the business case quite compelling. But I'd like to think the moral business case is in itself quite compelling. So as employers, we want to help, and the workplace is obviously the perfect gateway, now more than ever. And we know the difference effective support can have, but what does that right strategy or program look for us as we sort of all get into our plans for next year? In today's landscape, it is absolutely difficult to know where to start. There is an abundance of options from partners, providers, insurers, many whom you will meet today at this event. And the evolving needs of the workforce and how we connect that together is the thing we need to consider. And trying to address many challenges at once can be daunting, and the risk is we often offer too much choice, and it becomes really hard for employees to navigate what they need, when, how to access it, making it ineffective. So what is the best way forward, and what are the things we need to consider as we sort of launch forward into 25? When we review our strategies, I think there are three fundamentals to make sure they are grounded in the design, which aren't rocket science, but often are overlooked as we're sort of running a million miles a minute. So firstly, they need to be actionable, need to be realistic and simple to implement, something achievable and relevant for your business and their goals. If it's too conceptual, I think what we see is the rubber doesn't hit the road, so to speak, and we're not able to really show that tangible difference in terms of the daily, making a difference to your people on a daily basis. It, of course, goes without saying it needs to be affordable. In the current climate, budgets being squeezed. But there are always options, and we need to make sure that the solutions we put in place are sustainable, because taking away solutions that are working hard for us is obviously a very difficult thing to do. So modelling a few years out and tracking the investment is critical. And what I would suggest there is really making your partners and your providers work for you in that space and help you do that to ensure the financing is sustainable. And last but not least, impactful. And I think there are two sides to this impact. One is obviously we need to have confidence that these benefits will make a difference to people in their lives inside and outside of work. And that's about tracking outcomes, so tracking what's happening before, what's happening after. Is it reducing instances of absence, musculoskeletal issues, stress? Is it helping parents in the workplace navigate adolescent and child mental health issues, which we know is a big strain at the moment? Is it connecting people with wellbeing outcomes? So there's kind of the difference in people's lives. And the second part is, are you getting that return on your investment? Is it really working hard for you? And in turn, that's about considering things like reach, engagement, the quality of the experiences, using the MI and the data, the competitiveness in terms of the broader market, and is it innovative and evolving? And I think that's a really important space, given the pace of change now. It's kind of not putting it in and letting it run. It's kind of how does it evolve and use new technologies to push it forward. I think a really great example of that actually is the link between things like nutritional services, which have been emerging over the last couple of years. And it's a really critical way to obviously mitigate lifestyle factors, risk factors, particularly in the cardiac space, which we know are increasing drastically. And we're seeing great advancements there in terms of using AI screening tools to really scale and reach more people early. And those are the type of advancements that can plug into your overall health and benefits strategy. So I think there's a lot in that space, and in terms of impact, I think that's one of the areas to track. So looking forward, I guess, to 25, there are some key focus areas to explore and review to keep people thriving at work. And one of those areas, I think, is what part does digital experiences play? So this is about how can we use technology purposefully and effectively when it comes to health and benefits. And personally, it's something that really excites me because the landscape is absolutely changing at a rapid rate in a very positive way. And the things that we're seeing is just the leap in experience, in access, and those early outcomes. And from putting things in to seeing results, just not having to wait that lag time. I think the results are quite speedy and quite easy to see through the MI and tracking. So I think the space we're getting to in terms of health benefits and a digital strategy is that's becoming a hygiene factor. And it's really difficult to succeed in the space without it. And again, it's all about making sure we're embedding the right digital tools and that they're effective. We know that the demand is rising. It's absolutely rising in terms of online healthcare. We saw a huge growth a few years back during the pandemic, but years later, the demand only continues. And at Unum, when we look through our data, compared to the first half of 2024, we saw services such as the remote physiotherapy appointments with specialists double compared to H1 in the prior year. And it's a trend that we're seeing year on year on year. I think what that proves is the acceptance for digital healthcare is rising, but also it's becoming a really essential part of health prevention in the workplace. With sort of now having 5 generations at work for the first time and Gen Z coming into the workplace, expectations have drastically shifted. And this generation has never experienced the world without internet, like a number of us might have done. And their lives and experiences are really shaped by that constant access to technology. And they typically expect everything to be available at their fingertips. But with that comes their sort of need and thirst for innovation and being quite health conscious. So very positive things for us in the workplace. And they expect the workplace to cater for those needs in a personalised and on-demand way. So I think that is quite exciting because it's pushing us in that direction. If we link to that is the employer point of view on this. And I do recognise a few people in the audience who might have seen this and currently use this. We launched our employer portal yesterday, which for us simplifies things like making referrals, making claims for HR and line managers. They can do that on demand through a portal, have all the tools and information they need at their fingertips, from tracking case statuses through to quickly being able to communicate through to their end users or employees. So the 2 points kind of join together. It's about connecting the employee experiences to the employer experiences, and it pulls it all together to obviously inform your health and benefits needs and outcomes. But we sort of see that as step one. I think if we think back to the challenges that the workplace continues to experience that we touched on initially, the digital tools and that digital experience space really does offer us a manageable way to make a really big impact. Having said that, it's not a case of turning everything digital. It's about being purposeful and having a clear way of reaching more employees early. I think things like consumer duty has really helped us focus our attention on how we do that and how we communicate in a more positive and proactive way. I think it goes without saying that part of that then comes down to the insights that we leverage. So even in that example I've described, having things like digital health and wellbeing tools for employees, that flowing through into your employer portals and digital tools, and that giving you a really wide range of immense data that you can then use to understand emerging trends and priorities as you inform your plans for following years. So to that point about health trends, it sort of leads us to talk about how we connect the digital strategy and the health component of that. 16 million people today believe if their employer had offered better health and wellbeing support, they would have taken less time off work and they would have been more proactive in their jobs. I'm sure this resonates with a number of us or families or friends that we know. It just makes sense, doesn't it? It's common sense. But I'm not going to, talk specifically about what a connected health and wellbeing strategy is. We all know that we need aspects of wellbeing to work together across the spectrum, because at different points of time, employees are going to need different things and different benefits in their life. Because when you're often experiencing a physical issue, it impacts your mental health and so on. So implementing that strategy that's actionable, affordable, impactful will really be key in making sure it's working for you and your workforce. And we need it now more than ever. As I said, that NHS waiting list and pressure continues. So when you've got a connected health strategy that effectively supports different people in their, for their different wellbeing needs, we'll ultimately see better health and wellbeing outcomes. That'll be through continued care and increased utilisation and engagement. All key measures of quality and effectiveness, of course. So if I give you an example, we have a health and wellbeing app called Help at Hand, which evolved from being primarily a virtual GP service, and now it's a 360 total health and wellbeing support service, which has over 500,000 people reaching it now registered, and we reach thousands on a daily basis. And it includes things like lifestyle, nutrition, personal training, and it connects it all together. But I think the principles that we've seen that's really given us traction here, and we're pushing it as we move into outer years, is bringing everything into one place for that easy access and navigation. And that we've seen really skyrocket our engagement levels. So a number of our larger clients see 40 to 50% of employees engaging with the apps in terms of total workforce. And what they've been able to do is bring together multiple partners, multiple solutions, and push it all through one easy place, which has been critical to the success that they've seen. Secondly, being able to really promote prevention and early engagement rather than it being reactive clinical tools. So that's been a key part to raise traction and engagement. And last but not least, then the flow, as I said, of insights about what's happening at an individual level, but then at a business level, getting that all aggregated so you can then make future plans. And that kind of integrated approach really ensures that employees are receiving a total health and wellbeing support, be that preventative or clinical when they need it. So as I said, we've got about 500,000 people now using that app. So that for us speaks for itself. But we've also extended it to spouses, partners and dependents, because that need to support not just your employees but their wider family is becoming more and more evident. I mean, if we think about it, how can you possibly be productive at work if someone dear to you is also struggling? So we're sort of seeing an increasing need to support more of that family space in the benefit space. Just to summarise this part, I think one of the other insights that's really pulling through, we've seen some tremendous success, is the interconnected nature. And I'd love to share an example with you because we're seeing more and more case studies of this, which is how those different services are connecting. So often we're getting people coming through having like a physiotherapy appointment via the app, and in that appointment they'll establish that the person perhaps has some anxiety and would benefit from a mental health specialist or a nutritional specialist in terms of lifestyle and diet management, and bringing all those things together and being able to navigate that through the app itself has been tremendous in terms of early intervention and early outcomes. And we've also been able to add in a feature where that person can choose to shoot off their notes to the NHS practitioner. So in terms of connecting the care, making it really easy for that person to be quite proactive in how they manage their health, we're starting to see, as I said, some really great results that we think we can push further. So the last part I was going to cover before we move into questions was just about how this obviously flows into managing absence, which I think we talk about in many forums, and we talk about it in the way of it being same year on year, but actually the changes we're seeing in the digital experience space and the health space should be driving much better outcomes. If we think about the mental health struggle in the UK, it's about 47 days at the moment from referral to getting an appointment, when the SLA is 4 weeks. So being able to offer early mental health support on demand via the workplace is a game changer for individuals, and keeping people at work and reducing absence. And again, I think that's something we could all say is improving as we give more access through the workplace. So yeah, the final part here is just really about how do we use these tools effectively to manage absence. It's important to consider data. We've touched on that. How can we use the right partnerships, use the right communication channels, because it's not about having a really large suite of benefits if people don't understand or don't know about it. So that continues to be a challenge, but linking back to the digital point, it gives us a means of communicating regularly. So I think you've got your option of communicating en masse regularly through these digital channels, and then you obviously need your line manager network as your gateway to spot signs early and to push the support that they need in the moment. And last but not least, flexible work arrangements. This is probably goes without saying, the options that we've got there, but often they're seen as a regimented long-term solution, but they can obviously be used within return to work plans to keep people engaged in the workplace and alongside a health program or a carer program, whatever they're engaged in, but bringing it together as short-term solutions so that we're not losing people in the long term to sickness and absence. And that's all I was going to cover. I guess just with a quick pause, I'll do a quick recap. I think this is all about making sure we've got the right foundations and basics in place. And as we move into reviewing our plans for 2025, how can we enhance the digital tools and strategy we're using to make sure it's at the heart of what we're doing to get to our end people, connecting our health strategy, positioning utilisation and health outcomes so it's valuable to people and their families, and last but not least, managing short-term absence and bringing those tools together, which obviously is our bread and butter, but can't be overlooked in terms of those broader strategies and prevention systems.